Emma Kate Verdon. Okay, so I am here today to talk about the skeletal system. I'm going to first start with the axial skeleton, which consists of the skull, the vertebra, the vertebral column, and the thoracic cage. So the axial division of the skeletal system supports the head, neck, and trunk and protects the brain and spinal cord and the organs in the thoracic cavity. So the axial skeleton, like I mentioned before, consists of the skull, and so I'm going to kind of dig deep into that now. So the skull consists of the facial bones and the cranial bones. So there are 8 cranial bones, and I'm going to do the best I can at showing. So to start, I just have this little guy right here sitting up straight. You have the frontal bone here. There's one frontal bone, and then you have on the top side is the parietal bones, and then you have the occipital bone back here, and then the temporal bone, which is right here. Right here. Sorry. And then if you look at like an inferior view, like if I looked up like this, underneath, you would see the sphenoid bone, and that is connected to the frontal bone, and then behind that you would see the ethmoid bone, and that's if you look up like that. And so then we're going to move on to the facial bones. So you have the nasal bones, which I guess you can kind of see like that's the nasal bone right there. The lacrimal bones, which are like, okay, so it's like this, right? Let me get a pen. So like this bone right here. The zygomatic is this bone right here underneath the eye, or like on the outside of the eye right here. The inferior nasal concha is like the things that kind of like stick out. You can't really see it in here, but they stick out in the nasal cavity. And then the mandible is this right here. The maxilla is right here. Sorry, my fingers are all on the way. The palatine bone, this is also a bone that if you look inferiorly, like up into, like if I cut this off right here, you look right up in there, it's the bone that touches the maxilla. The vomer is inside the nasal, or it's in the inferior part of the nasal septum. And then the auditory ossicles, which there's like just kind of a little opening right here, which contains the malleus, incus, and stapes. So that is going to complete the major components of the skull. And so now I'm going to move on to the vertebral column. Put this little guy back up. The vertebral column, as like an adult, full grown, you're supposed to have 26 bones, but infants have 33 bones because the sacrum and the coxal bone have not fused yet. So to start with the cervical column, I'm going to turn my little friend around, and so there's cervical, thoracic, and lumbar vertebra. The way I kind of remember it is there's 7 cervical vertebra, 12 thoracic, and 5 lumbar. I remember it as breakfast, lunch, and dinner. So starting with the cervical vertebra, there's C1 here, and that's also known as the atlas. C2, which is the axis. C3, C4, C5, C6, and C7. And then we start with the thoracic vertebra, which there's 12 of. So you have T1, T2, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. and that's going to end the thoracic vertebra, and then you start with the lumbar vertebra, which is 1, L1, L2, L3, L4, L5, and then you get to the sacrum, and at the very tip is the coxal bone. And the sacrum is 5 fused vertebrae, and the coxal bone right here is 4 fused vertebrae. So that makes the total of 26. And then we are going to move to the thoracic cavity, or the thoracic cage, which consists of the bony framework of the chest. So we'll start with the sternum, which is this piece, which is this bone right here. And the top of the sternum is the mandibrum. And then this is the body of the sternum, and this is the xiphoid process. And so now I'm going to focus on the ribs. So there are 12 pairs of ribs. So the first 12 ribs, the first 7, ribs, 1, 2, 3, 4, 5, 6, 7. These are considered as true ribs. And then if you go 8, 9, 10, those are considered as false ribs. And then these bottom 2 right here are floating ribs. And so that's going to finish up the thoracic cage. And so now I'm going to move on to the appendicular skeleton, which consists of the bones of the upper and lower limbs and the pectoral and pelvic girdle. So the pectoral girdle consists of the clavicle, which is the collarbone, and then the scapula, which is the shoulder bone, and you'll find that there. And so the upper limb is connected to the axial skeleton by the clavicle and scapula. So the upper limb consists of 30 bones. You have the arm, forearm, and hand. So the arm is what this thing is right here, the humerus. Then you have the forearm, which I always remember radius. You have the radius and ulna in the forearm, and I remember as PU, pinky, ulna. So this bone right here is the ulna, and this bone is the radius. And then you go into the carpals, which that's hard to really kind of tell exactly what bones are which here, but the carpals is the wrist area, and on the proximal side, from lateral to medial, lateral being the thumb, you have the scaphoid bone, the lunate bone, the triquetrium bone, the pisiform, trapezium, trapzoid, capitate, and hamate bone, which is the palm, and then you have the phalanges, which is proximal, middle, distal. So now I'm going to move on to the pelvic girdle, which is the hip bones. You have so this is the pelvic girdle, this area. Gosh, sorry you can't see. Closer to me. So this is the ilium, this is the pubis right here, and then this bottom part right here is the ischium. So now I'm going to move on to the lower limb, which consists of the thigh, leg, and foot. So first you have the thigh, which is the femur, and then you have the kneecap, which is the patella. Oh, sorry, you can't even see me. The patella. Then you have the foot, which is the tarsals. The heel is the calcaneus bone, and then this bone on top is the talus. So then you have the navicular, the cuboid, the lateral cuneiform, intermediate cuneiform, medial cuneiform, and then the metatarsals, metatarsals right here, and then you have the proximal and distal, or proximal, middle, distal. And the thumb, it's also like this in our hands too. does not have a middle phalange. So now I'm just going to kind of talk about the bone classifications. So we have the long bone, which is cylinder shape. It's more long than it is wide, and that is the femur. We have the short bones, which are more cube shaped. They're all equal in length, width, and thickness, and that's like the carpals, what we see in our hands, and the tarsals, what we see in our feet. We have the flat bone, which is like thin and curved. An example would be the sternum. We have the irregular bones, which is the more complex shape, and that's like the vertebra, which you see here, or the facial bones, where we have the sesamoid bones, which are small and round, and that is like the patella and the knee. So I am studying to be a pharmacist, and I would love to specialize, or I really want to specialize in oncology pharmacy, and study like the research and study and like the study of research and disease, kind of. So a clinical application would be just bone cancer, osteosarcoma, which starts around the bones and the knees. So my job would be for the treatment of chemotherapy and radiation. And so I think that's going to finish up the major components of the skeletal system. And yeah, thanks so much.